Well, good morning. Keeping in the vein of being, sharing personal stories, I just went through quite an experience over the last couple of weeks. So I thought I would share it because it speaks to a lot of the stuff that I talk about regularly. So what it's entitled is The Perfect Storm: How AI Medical Misinformation Nearly Killed Me While I Discovered a Breakthrough Treatment. So the irony of trust. I don't trust AI to understand niche topics or complex systems thinking. I've seen too many times confident responses that completely miss the nuanced connections between seemingly unrelated phenomena. And I've given you examples of that multiple times. Yet somehow I trusted AI for what should have been straightforward medical information, basic pharmacokinetics, data about medication half-lives. That misplaced trust nearly killed me. This is a story of how AI medical misinformation led me to toxic drug accumulation while simultaneously helping me stumble onto a breakthrough approach to treating chronic inflammatory conditions. It's a perfect storm of technological failure and medical innovation that illustrates both the deadly risks and unexpected opportunities in our current healthcare landscape. The systems thinking breakthrough. For years, I've been developing an interdisciplinary systems view of chronic illness, particularly focusing on how inflammatory pathways connect seemingly disparate conditions. My hypothesis has been that cancer, autoimmune diseases, and chronic inflammatory conditions like hidradenitis suppurativa, HS, all share common mechanisms involving platelet activating factor, PAF, interleukin cascades, and cytokine storms. This is it's oversimplification, but follow me on this. Recent research on low-dose naltrexone has validated this framework. Low-dose naltrexone, LDN, shows promise for both autoimmune conditions and cancer through its anti-inflammatory effects on cytokine modulation. Now, I've mentioned this, if you've been listening to my podcast, I've mentioned it multiple times that I believe inflammation will be connected. I've been proven right about dementia, but I believe it will show a strong connection with cancer and inflammation. The reason why I mentioned that is I heard of some research in this area a number of years ago, but I've heard very little since. And I think the low-dose naltrexone that they've studied it, it's shown that it helped with chronic disease, helped with chronic inflammation. And now they want to try it for cancer research because of this. So obviously there's a connection there, right? If a single mechanism can address such diverse conditions, it suggests we're looking at fundamental inflammatory pathways rather than separate disease processes. Just referencing how PAF seems to connect so many of these different processes. So this led me to investigate rupatadine, an antihistamine with unique anti-PAF properties. PAF is a potent inflammatory mediator elevated in both cancer and autoimmune conditions. If my systems theory was correct, rupatadine's dual H1 antihistamine and anti-PAF activity could target multiple points in the inflammatory cascade. Now, the cannabis-inspired innovation. Drawing inspiration from cannabis research, I developed what I call an entourage effect approach to antihistamine therapy. I take it both in combination from, I've developed an acid-based form of cannabis therapy, meaning non-psychoactive forms of cannabis. I got this idea from the Israel full-spectrum cannabis research and studies. But I also realized that many of us are using high THC cannabis when we should be using, like, for example, high CBG or high CBD, CBN, CBV, whatever. It's the low-frequency cannabinoids and maybe even the cannabinoids we haven't even studied yet that are actually the benefit in cannabis. And all of these different cannabinoids and terpenes or whatever that's working seem to be operating at different levels. Different cannabis will give different benefits, different help for different conditions. It's from that I extrapolated an entourage effect with histamines, right? Different antihistamines, different ways of treating. So attacking it using DAO, diamine oxidase, to downregulate the histamine, fighting the PAF, fighting inflammation, fighting H1 and H4 histamine receptors, using Pepsid, which is an H2 antihistamine, using all of these in combination, right? Vitamin D and vitamin C. This entourage effect has never been applied to allergies, let alone to dosing of antihistamines, nor has it been even considered in this area as a novel, I guess, off-brand use, not as an antihistamine, but as an anti-inflammatory. But I continue here. Instead of using high doses of single agents, I began rotating through different antihistamines, H1 and H2 blockers, with complementary mechanisms. The theory was that no two antihistamines are identical, so using multiple agents could provide broader anti-inflammatory coverage while avoiding the tolerance and side effects of high-dose monotherapy. And as I'll get to, also the toxic effects of an antihistamine that has a half-life exceeding 24 hours. That means every day the medication is building up. So either we don't use that medication or we use it in rotation, as I'm going to suggest. Or technically, I think if doctors were going to recommend this particular drug or any antihistamine with, say, a half-life of 27 hours, they should recommend that they take at least one day off a week. But I'm not a medical professional. Don't take any of your medical advice from me. Just take the advice of having an open mind. No one source of information is absolutely the be-all, end-all. So keep an open mind when it comes to that. Trust, but verify, right? So the results were and have been remarkable. My brain fog lifted, energy returned, chronic nasal congestion resolved, and overall inflammatory systems decreased dramatically. I was using desloratadine for systemic effects, different H1 blockers for specific symptoms, and H2 blockers for their distinct anti-inflammatory profiles. The example I give is, for years I thought I had acid reflux, but no, what I have is a mast cell or a histamine intolerance issue where my gut is overactive, producing too much histamine, and it makes perfect sense. And yet, having had an allergist and an immunologist throughout my life as a child, never once has a doctor ever mentioned this. And in the year that I've been working, trying to get these antihistamines to work, has a doctor even understood? Has a nurse or a pharmacist? Very few, if any. In fact, I had one pharmacist who lied to me about their knowledge of antihistamines. They had no knowledge of the most recent antihistamines. They didn't even understand that there was multiple generations of antihistamines. Whereas my doctor eventually came to realize that I was not your usual bear. And he admitted when I was talking about wanting to add the H2, the Pepsid, H2 antihistamines to my protocol, he just didn't know what I was talking about. But he thankfully admitted that, oh, you know more about this than I do. But that's what led to this medical mishap. With no one else to approach, I've talked to pharmacists, I've talked to doctors, and none of them understood using the antihistamines for the way I'm using it. Never mind not understanding how to titrate the dose and rotating through different antihistamines. They don't understand it. Even the pharmacist that I was talking to last didn't understand why I would want to use different antihistamines. Again, his assumption that is that I was looking for one rather than rotating through multiple ones. I was looking for the ones that would have the least side effect and have cross benefit, right? I'm taking certain ones for the regular, what all doctors think antihistamines are for, right? Rhinitis and itching, the run-of-the-mill watery, itchy eyes. I mean, that's the other thing too. I mean, I had no idea that I could save a fortune on allergy eye drops by taking these antihistamines, because I mean, that's another thing that I would do regularly. It just shows the level that the body can get into, but it's in reverse. It shows that when we're treating all of these symptoms individually, my chronic pain, my chronic inflammation, the acid reflux, heartburn, my nose running, my dry mouth, my sinuses being painful, headaches, painful eyes, bloody red shot eyes, itchy skin, you name it. All of these symptoms have one source. If you can treat that source, then you don't have to treat all of these, right, in isolation. But again, the problem here is I'm using medication that was designed for a different purpose. We're using it essentially off-label, right? I'm using rupatadine now not as an antihistamine. I'm using it as an anti-platelet activating factor pill, and I'm using other antihistamines for their antihistamine effect, right? I learned this from my disease. I was supposed to be prescribed certain antibiotics at a low dose because for some reason they still don't understand completely. But these certain antibiotics used at a low dose will provide an anti-inflammatory benefit. But the doctors, I guess, were too rush, and they're still prescribing the wrong antibiotics. In fact, there was a study showing that you need to not give people clindamycin and rifampin together because it just counteracts each other because of the body load. And clindamycin on its own is just as good or better. But worse yet, I was given prescriptions by a dermatologist for the wrong type of antihistamine, not one of the ones used at a low dose, and at an antimicrobial dose level. So I couldn't even use it for the low dose. And I also got this morning, I stole the idea from the research on low dose naltrexone. Naltrexone is an anti-abuse drug, if I understand it correctly. It was designed to help people with opiate addiction. But they did some studies, and at a low dose, naltrexone is a very potent anti-inflammatory interleukin blocker, all sorts of stuff for chronic illness and inflammation, to the point now they're going to start trying it for cancer intervention. So that makes the case that I've been making for years now, that I believed that we would see inflammation tied directly to cancer, because I've been saying this for years. Listen to my podcast. I've been saying for years that inflammation is going to be what we thought stress was many years ago. It's going to be the new issue that we have to deal with. Sadly, it is a multimodal issue, and it needs to be treated in a multimodal fashion. But once we understand what we're working with, that inflammation is, yes, the symptom, but if we can track back the cause, then maybe we can begin healing people, right? And all of this just by accident when you come across these different little tidbits of information. But as I've asked the AI, and again, we have to be careful about what we trust or believe from them. But the problem is doctors are so over-specialized, right? The doctor I go see might not even be familiar with the PAF factor in rupatadine because drug companies are selling it as an antihistamine. They don't even mention it to him, right? Or my pharmacist, he's been trained on how to prescribe medication for people with certain illnesses. He's not probably familiar with using it for off-label or like I'm using, right? Either adjusting antihistamine dose to personal biology, half-life, and need, and yada, yada, yada. And none of that is really in their wheelhouse. It's something that either makes them uncomfortable. It's like my doctor, right? Like when he asked me where my HS is affecting me, I'm like, everywhere. I didn't even think that he would be one of these doctors that still thinks that a skin disease only affects the skin and doesn't understand that it's like lupus. It affects every system in the body. But again, I digress. So now on to the AI misinformation crisis. Here's where the story takes a dark turn. When I consulted AI about rupatadine dosing protocols, I was given incorrect information about its half-life. The AI told me it was significantly shorter than the actual 27-hour half-life. Based on this misinformation, I calculated what I thought was a safe dosing schedule. With a 27-hour half-life, rupatadine accumulates dramatically with regular dosing. Each dose adds to what's still circulating from previous doses. Within months, I was carrying toxic levels in my system, roughly equivalent to someone taking massive overdoses daily, but spread over time in a way that masks the accumulation and the symptoms. So what I mean by this? Well, my doctor prescribed rupatadine. I don't understand why he would say this. 1 to 2 pills daily. Didn't mention anything about. So again, this is the guidance I'm going from. Because again, gateway, these nurses, his gateway, they do not want you to have anything to do with the doctor. They consider themselves the doctor. They're the ones doing. So I could sue them for medical malpractice, I'm assuming at this point, but we'll just consider this, if I hadn't gone through this, I wouldn't have figured this out. So I tried the one, and it helped, but it didn't have the dramatic effect I was hoping for. And because he said 1 to 2, so I tried 2 a day. Tried that for a very short time before it started to become toxic, so I stopped that. Back to 1, looking for other options. So I started playing with the half-life, my metabolism, and I used this with the AI. I said, okay, listen. I tried taking 2. I could only take it for whatever it was, 3 weeks or a month, and I found the side effects too much. So it should have used that insight. So we played with my metabolism and what the half-life might look like in my body. It gave me something like a 15-hour half-life, right? And because of my slow metabolism, I assumed I added more time to that. But what ended up happening is even if and this is what it told me was novel, I was because they only come in 10 milligrams, I was taking 1 pill one day, 2 pills the next. 1 pill, then 2 pills, 1 pill, then 2 pills. Right? And I've explained this to all the doctors. I said, I took 1 pill on even days, odd days, and 2 pills on even days, right? So you can remember, if it's an even day, it's a 2-pill day. But within a month or so or 2, it had gotten so toxic, I couldn't even walk anymore. Right? I had become so stripped of electrolytes, so dehydrated, and so inflammatory, flaring, that my joints were so inflamed. I mean, I couldn't get up, I couldn't sit, I couldn't walk. Literally couldn't walk. Like, my health has been almost destroyed by trying to figure this out, because I thought it was my fault. 6 months or 8 months ago, gained weight and was having a hard time walking. My feet are so much worse. My arthritis is so much worse, right? Because if you know me, I used to walk 8 kilometers a day. Now I struggle to get in my walks. I used to love to tell you, right? It was a big part of my day because I got most of my listening, my audiobooks, my reading done on my walks. But then I got so sick. All because of, arguably they didn't give me the proper guidance. They just didn't care. But from that, I've discovered the beauty of rupatadine. I'm so lucky they didn't take it off the market, because simply you can take it just a couple times a week and get the benefits from it. It's beautiful. And the other times of the week, like for me, what I would do is probably take Allegra on the same day with the rupatadine to give me some of the benefit of the antihistamine. And then alternate days, I use a different antihistamine. Right now, I'll be using, say, the brand name Arius. It's a knockoff. Desloratadine I'm using. 5 milligrams a day. It seems to be lots. Right? I've experimented taking the Allegra with it, but I might even experiment taking 2 of the desloratadine a day. Right? Just depending on its half-life. But follow me here. This new doctor that I got, I mentioned, he's like, hey, you wanna go with this relationship? I'm like, oh yeah, sure. But let me ask you one question. I'm like, what's your opinion on having your patient to be part of the healing process? I said, agency. He said, oh, well, in some no, he didn't agree. He should have right away went, oh my God, that's the most important part of healing the human being is agency. How am I supposed to help you if you can't tell me that the medication is causing this or your benefit? If you're not paying attention to your own health, then how can the doctor heal you? Right? So I was a little disappointed when he didn't show, but here we are. So let me just tell you, this experience has been difficult. The symptoms were devastating. Unable to walk due to not just hip inflammation, but it was so bad. I couldn't sit or even lift my legs. I had severe gastro, you know what I mean? So when it was difficult to even sit, imagine needing to sit in the bathroom a dozen times a day. It was not fun. I couldn't sleep. My chronic pain was so intense. I thought I had blood clots or something had gone really wrong with my legs because the pain radiated so bad. But I just think one thing my doctor did teach me is that the inflammation is worse in areas that you were injured before. And because I played football and I spent most of my life trudging through the wilderness in Northern Ontario, my hips, my knees, my toes, I have a lot of issues. And so I have arthritis, and it has gotten worse since the COOF in 2020. My arthritis just got way worse since then. But it makes sense that I'm worse in different areas based on injury and history. Because I have this weird theory that rheumatoid arthritis isn't destroying the joints per se. There is some of that in there, but I think what's happening is people take pain meds or they push through the pain, and they're damaging their joints when they do that. Because see, what I've found is when I tried to push through it, when I would still walk even when my joints were inflamed, what I would do is not permanently, but I would injure myself to the point where it was no longer just painful and difficult to walk around, to the point where it was like I could not walk, could not lift my leg because I had, I don't know, stretched something or tore something, whatever. My hip would not move, my leg would not move. So I found that the only thing I could do would be to just walk like a really old man, right? Don't walk too fast, don't take big steps, don't move too sharply, and do that for a couple days. And then the inflammation calms down. And usually what I'll do is I'll fast, or I'll use all the different protocols that I've been using for a long time without pills to fight the inflammation. So imagine my frustration when I'm trying to add in what is supposed to be a simple thing, an antihistamine, and it's been this much of a frustration and a hassle, right? So I can well understand what it's like for patients, and I can understand what it's like for doctors, right? Because not all patients will be like me, right? Because the doctor's going to hate me because I blasted him in the face with a fire hose with all of this. And trust me, I put all of my medical information down on one page. So you can imagine what's actually there. But neither here nor there, right? I thought there was something majorly going wrong, but it was only because of either medical malpractice, misinformation, ignorance, apathy, whatever the cause. I wonder how many people are suffering because of similar reasons. So the cruel irony, the most bitter irony is that AI medical misinformation nearly killed me while I was discovering that rupatadine could be a game-changing treatment for chronic inflammation and inflammatory conditions. The 27-hour half-life that made it toxic with daily dosing actually makes it perfect for rotation protocols. Instead of taking rupatadine daily and building to toxic levels, it could be used once or twice, 3 times a weekly as part of an antihistamine rotation. Again, that's my own invention here, to rotate through different antihistamines. This would provide the anti-PAF and anti-inflammatory benefits without the dangerous accumulation, plus the benefits of what I would call the entourage effect, different forms of antihistamines that affect or act on different receptors, and even, like I said, there's the H2 antihistamines that work on the histamine produced in the gut. So healthcare system failures. This experience highlights multiple system failures. Medical negligence. My walk-in clinic doctor, my walk-in clinic doctor, I told him about the rupatadine, and he never mentioned anything about the half-life or accumulation potential. When I called my actual doctor reports, there was no follow-up or concerns. AI as medical authority. What I'm talking about here is just when I was trying to figure out all this antihistamine stuff, there was an ad saying that people were turning to AI for medical help, especially for complicated medical stuff. So it gave me the idea of, rather than me slogging through all of this PubMed and this medical stuff and reading the pages that come, I thought, well, AI should be able to get me this basic stuff, right? Like drug half-life, interactions. Wait, this is just plain factual stuff. This is not opinion or right? So it seemed to me that it would be able to get this quite easily. All right? So people are increasingly using AI for medical advice. And that's the articles I read. And they say especially for complex conditions where traditional healthcare has failed him? Well, like I said, many of us with chronic illness develop white coat syndrome because they treat us like pincushions and don't really seem to care because we're just too complicated. But AI systems can confidently provide incorrect information that leads to dangerous medical errors. Like a doctor, but maybe worse. So the lack of systems thinking. The healthcare system treats symptoms rather than understanding underlying inflammatory mechanisms. My approach using targeted low-dose interventions based on pathway understanding could be both more effective and more cost-effective than current standard care. Now, this is the discussion I was having when I was drafting the script, is I've been treating my illness naturally. In fact, my doctor had to write me a prescription saying, hey, this kid wants to heal naturally, support him in this. Because they push surgery and incredibly powerful biologics that just mess with the human body, right? But imagine, I'm at a loss here because just so you understand, never mind what it would cost for surgery, because I would have probably had a couple surgeries by now because I have a couple of very serious issues that still continue to be a problem, even though my HS is well managed. Right? I even mentioned it to my doctor. There's this idea of cryotherapy where they freeze the sebaceous site that's still problematic, which would save me. I mean, he'd only have to do a half dozen different spots where I have continued issues, but that would almost put me into complete remission if he were to do that, right? Because some of the other sites, I think once I get this protocol set up, I don't think they'll really be causing me all that much issue anymore. My main issue is where we have, arguably, that's where the cancer concern came in too, where there's so much scar tissue and so much issues that, they believe that the sebaceous site have themselves become unnatural. Right? It's not simply waiting for unnatural signals that in the local site they are acting irrationally and causing inflammation and possibly even local infection, biofilm, who knows? But the irony is, if I had gone on just the biologics alone, the taxpayer cost for me alone would have been in the millions of dollars. Millions. Because when I was first diagnosed, I figured the math back then. Just when they first approved the one biologic, if I had been on it before any of the cheaper versions had come out, it would have been about $2 million that it would have cost the taxpayer. That's just for about 2.5 or 3 years. I can't remember the exact time frame, but it was over $2 million. And that's assuming I said no to surgery. If I had gotten any surgery, well, then you could have pushed that closer to probably 2.5 million. But I did it by changing my diet and lifestyle. I didn't even get medication. But when I did get medication, the irony is I have to pay for it myself. I don't have medical care. I mean, we're a single income household. Well, not technically, but you know what I mean. According to... I used to make an incredible figure. This is where I'm coming from. I used to make nearly 6 figures. And then when I got sick, now I struggle to make, $5, let alone 5. I'm exaggerating. But what I mean is, because I can't work for someone, because some days I might not be able to walk, I have to work for myself. And when I am working for myself, obviously that's much more difficult. It puts more stress on the household and the family, and especially since our lifestyle has changed, right? Going from, 2 incomes in the family, right? And my income was twice that of my wife's, at least for the most part, when I was working, right? But say, even if it was half and half, I mean, our income dropped in half. Meanwhile, we're needing to support both of our health issues. Right? But imagine my concern, I told you I'd probably be diagnosed as autistic 25 years ago. My concern was not wasting money needlessly. Right? But The reason why I said no to Humira wasn't because of the tax dollars, it's because I researched it. And only 20% of people were still on this Humira. And again, after a year, only 20% of the people were still on it. So that means the taxpayer paid about $500,000 or so, maybe more, depending, for them to be on that medication. But only 20% of them stayed on it. Well, if it was placebo, if it was a sugar pill, 35 to 50% of people would still be on it. Huh. So that means it's worse than placebo. The side effects are so bad that it forced the majority of people off the medication. Only a small percent of people were seeing the benefits or whatever. They stayed. But imagine. That's the only protocol. And when I suggested 10 or 15 years ago that there might be some diet and lifestyle connections, I actually was kicked out of HS groups for suggesting the diet connection. Can you believe that? But fast forward to today, now the regular guidance is to avoid dairy. That's one of the first ones that they believed me on, and they added into a recommendation. And then later, nightshades, but they didn't listen to me fully. I said not all nightshades. I explained that it was histamine in the nightshades, and they don't listen to me because they don't, again, understand. Because histamine, allergies, immunology, it's some of the most complicated science in medicine there is. And I'm not being insulting to the doctors. It's just not in their wheelhouse, right? They can only learn so much, am I right? But what we need is more systems thinkers. I guess what we need is doctors that are less specialized, more interdisciplinary. But that's a different issue, and I digress. Let's keep to the point here. So the economic irony is by managing HS through research-based innovations rather than conventional surgery and biologics, which can cost between $10,000 and $40,000 a month, I've saved the healthcare system hundreds of thousands of dollars, if not millions. Yet I received no support for this approach and am treated as non-compliant for refusing expensive interventions that don't address root causes, right? I even get treated as non-compliant just for questioning the doctor, questioning nurses and their assumptions or the protocol. Like, can you believe this, right? So the larger implications here. This story illustrates several critical issues. AI medical misinformation. AI systems providing confident but incorrect medical information can be deadly. People need to understand that AI can be wrong about basic factual information, especially in specialized domains like pharmacokinetics. Innovation through adversity. The same experience that nearly killed me led to breakthrough insights about antihistamine rotation, protocols, and systems approaches to inflammatory disease. Systems versus system thinking. You can see I was reading ahead. Understanding the inflammatory pathways allows for targeted interventions that address multiple conditions simultaneously rather than treating each symptom separately. Healthcare access crisis. In systems like Canada's, people with complex conditions are essentially abandoned, forced to become their own researchers and advocates while navigating broken care delivery systems. Now, the example I used when we were scripting this, we didn't put it in, but I saw the failure of the healthcare system when I went in. I just stopped going to my doctor because he said, there's nothing more for you we couldn't do. He was just treating the symptoms. He didn't even bother didn't even try to figure out what my HS was. Again, the new doctor that I got asked if my doctor did blood tests, and I just laughed. He's like, no, he never did. He tested for basic stuff, B12 and but never did any inflammatory tests or any of that sort of stuff. So I go to the hospital because I got an abscess in my thigh so bad I just couldn't walk. And so here's one big issue. They're saying the longest wait time in Canada now is in Quebec at 5 hours, but they've changed it. We used to say how long it took for someone to be treated. Now that 5 hours is how long they sit in just the waiting room of the, what do you call that? The triage, right? Because I know for a fact That's bad then. Because when I went to the hospital, I'd spend an hour or so, maybe sometimes longer too, waiting to see a doctor, but that was just the beginning. Then you sit in the doctor's office for 3 hours, and then you sit and wait and wait and wait and wait, right? So if you waited for an hour and a half in the ER waiting room, you probably didn't get out any sooner than 6 or 7 hours, all told. So when they're saying it's a 5-hour wait in the ER, just in the triage, then you're probably looking at what they've been talking about, 16-hour turnaround for most people. Or in reality, it's probably, if they were actually treating people, it'd probably be more like 24 hours. Because they say the number of people who just give up and leave, because I got to tell you, I couldn't do that now. I couldn't sit in that ER triage. It's usually glassed in and all enclosed, and you got a dozen people sitting there coughing and hacking. It would kill me. It would kill me. Just the stress alone. Never mind that I'm, could get infected by one of their terrible diseases, but I mean, I'm super healthy. My only concern would be in there. That stress alone. You know what stress does to the immune system? Yeah. So that's the problem here is when Canada, and AI even said that, when our healthcare system has been declining since 2020, what are we going to do? Remember, they said they were going to invest money. Oh boy, if we had taken just a fraction of the money they wasted on stupid things, we could have the world's best healthcare. But we don't. And what's worse is chronic illness has doubled since they've allowed this all to fall apart. So imagine what they have to look forward to. Right? I talk about this when it comes to therapy. They did a meta-study that showed that therapy looks like it's been a net negative to society. But I don't think that's the problem. What I think is therapy should be reserved for the really seriously broken people. Because most of us could probably do with doctors, counselors that are trained, right? Psychologists. They don't have to be incredibly specialized. They can just have some, mental health support training. Because most of us could do with just that. We'd be fine with that. We don't need the full-on shrink. But I think the real problem is we used to have our doctors, our lawyers, our bartenders, our neighbor, our mechanic, our grocery clerk, even the vegetable attendant at the food market. I mean, these all used to be our therapists, our friends, our pals, our confidants, I think that's why we've seen a marked rise in mental health, mental illness, and anxiety and depression. It's not just diet, lifestyle, and all this inflammation and all these ideas that I'm talking about. It's just if you marinate in toxic negativity, I mean, are you any surprised that becomes your default, right? So what's the path forward? My experience suggests several important directions. Medication protocols. Drugs with long half-lives need rotation-based rather than daily dosing protocols to avoid toxic accumulation while maintaining therapeutic benefits. Well, I mention this most importantly because I guarantee you doctors in the know are not prescribing these drugs because I don't believe they trust their patients to be able to do this. But again, without that agency, the doctor's wasting their time. If the person isn't involved with their own health and their own healing, then it's a waste of time, right? And it needs to be mechanism-based in treatment. Understanding drugs' anti-inflammatory mechanisms like low-dose antibiotics, low-dose naltrexone, and antihistamines. This could lead to more effective, targeted therapies rather than empirical off-label use. That's what I was saying when we were preparing the script, is that many of these drugs are showing benefit, but only as an after effect or a side effect. But like, imagine. Why aren't we looking at what the mechanism of action is in these certain antibiotics that provide an anti-inflammatory effect? Why haven't we? We've known this for over 20 years or more. So why haven't we pulled out that particular method of action and provided it as a standalone treatment, right? Or the PAF factor in rupatadine? No. Rupatadine's off patent, so no one gives a rat's anymore, right? Or low-dose naltrexone. No one goes, well, wait a minute. That's pretty serious. You're giving someone this major medication. Yes, I get it at a low dose, but we don't know its full implications. So if we studied it, we understand why it works, but we also might be able to understand how it works to maybe improve it and also prevent any negative side effects. Just makes sense, doesn't it? But I digress again. So AI safety in healthcare. We need better safeguards against AI medical misinformation, especially for basic pharmacological data that people assume is factual and reliable. But I go one step further. The AI could even make sure that this stuff wouldn't happen. I mean, these people aren't free from this. My grandmother was almost killed by a doctor who prescribed her 2 conflicting medications, and she was on multiple other ones as well, and the pharmacist didn't catch it. So, right? So the problem isn't AI. This problem has existed for a while. The problem is relying too much on any one thing. So systems integration. Healthcare needs to move beyond treating isolated systems towards understanding the interconnected inflammatory pathways that drive chronic disease. I go further than that. I explained when we were writing this script that look at dermatologists. Still to this day are treating skin disease as if the skin is in isolation from the rest of the body. Same as doctors treating people as a body. Right? I've told you this before. Basil van der Kolk's famous trauma scientist, and Bullmore, Dr. Bullmore wrote The Inflamed Mind. They both said when they started as shrinks, they were shocked that they were told to leave their medical practice behind. You're not treating the body anymore. You're treating the mind. Separate things. They said there was a disconnect there, but did they do something? No. They took off their stethoscopes and were played like the good boys they were, and didn't complain about this disconnect until they'd retired. Ooh, that's painful. So they admit the disconnect to sell books, but they don't work through the disconnect to save lives and maybe even develop a new protocol, a novel protocol that could heal people. Ooh, geez, can you imagine? Right? So in conclusion, I nearly died from trusting AI and arguably trusting my doctors too much. I nearly died for medical information that should have been straightforward and factual, should have been given to me by my doctors or the doctor's assistants or their nurses or the pharmacists. None of it was provided. Yet that same near-death experience led me to insights about inflammatory disease treatment that could help thousands, if not millions of people with similar conditions. This perfect storm of technological failure and medical innovation, it illustrates both the promise and peril of our current moment. AI can provide dangerous misinformation even about basic facts, but systems thinking approaches can unlock breakthrough treatments that conventional medicine misses. A lot of S's in there, which is a problem for me. And then the systems thinking is not something I'm used, right? You're not used to systems, right? System or systems. The question isn't whether to trust AI or traditional healthcare. Both have failed me in different ways, but we can't throw out the baby with the bathwater. It's not deconstruction. It has to be reconstruction. The question is how to develop better systems for validating medical information while encouraging the kind of interdisciplinary thinking that leads to genuine therapeutic breakthroughs. I would really ask, what novel healing protocol, anything have they come up with to heal a disease in the last 20 years? I can't think of really off the top of my head anything that wasn't just iteration on something that came before. But I digress. It's what I do best. We need safeguards against AI medical misinformation, but we also need healthcare systems that can recognize and support innovative approaches to complex conditions. Otherwise, we'll continue to have people like me forced to risk their lives to find solutions that should be available through proper medical care. The irony is that the very mistake that nearly killed me revealed the solution I'd been seeking. Sometimes the most dangerous failures illuminate the path to breakthrough success, but we shouldn't have to risk our lives to discover what proper medical research and systems thinking could reveal safely. And for me, I didn't tell AI. I was giving it, like the example I would give, not like this, ooh, doom gloom. No, the joke I would have said was about, was it Abby Hoffman? Was working, I think, for Lilly. I can't quite remember, but no, I mixed them up. No, sorry. Start over. I think it was Hoffman who was testing lysergic acid to thilamide, and he accidentally was dosed, right? And so he actually dosed again later to see, right? So this idea right here. I mean, I think there's as much medical innovation in accidents as there is in intention, but I argue a big part of that is maybe we don't have enough intention in our healing. Like I said, the most important aspect in your healing is your agency. You must be involved. And when doctors hesitate about the importance of a patient's agency in their healing, we may be at a crossroads. I think the dawn of a new renaissance, but one might never know. But so thank you for hanging out while we talk about all of this personal stuff. We'll see whether this is, it probably won't be quite as popular as the vanilla Buddhism stuff, because again, right, hearing about vanilla Buddhism isn't challenging to the status quo. It just teaches you how to accept the status quo, right? And me, the way I am, well, you can well understand why I don't accept the Western concept of Buddhism and why I wrote my own tours in the Buddhist temple museum, because I refused to teach Buddhism the way they tried to teach it. I wanted to teach it the way it's meant to be taught, right? Not out of ego, but out of sufficiency. When you give a tour and all you talk about is, the mythological stories, that's not going to guide anyone. But when you talk about, universal truths or perennial truths, that's when you can, maybe chip away at that thin veil that keeps us from observing the observer and thinking about these things more deeply. As Albert Camus said, there really is only one serious question in life, and that's of philosophical self-termination. Right? And he's not meaning the physical act. We're talking about the metaphysical act. Right? If you forgo your agency, I told you this before, there's a paper on whether free will exists, but they open it by saying, well, we all know we can't actually test free will, because even if we did have it, whether we have it or not, we can't know, because we can't know whether we'll actually engage with our free will. And I told you before, that's what some philosophers misunderstand about Nietzsche, right? They misunderstand and believe that he didn't believe in free will. That's not true. Nietzsche believed in free will. He didn't believe in us using it. That's your agency. But we have two choices here. We can't continue ahead without agency. We are not a headless being. Right? Remember T.S. Eliot, right? We are the hollow men. We are the stuffed men. Row upon row. Head pieces filled with straw. Something like that. But it's plain and simple, this idea. Are you going through the motions? Are you a non-player character? Have you given in fully to nihilism or apathy? That's what Camus is talking about. Right? It's a radical act to accept life as absurd, as suffering, if you will. But the real radical act is to accept that as Nietzsche's eternal return or the Amor Fati. Albert Camus says you must see Sisyphus. In English they say happy, but heureux. You have to see him heureux in French. Heureux is yes, happy, but It has this idea of being, content, happy with his lot, not dissatisfied. And you get what I mean? So remember that. We must imagine ourselves happy.